real rally action to begin. Bridget Ngana, NTV, Nakuru.
Right, Bridget Ngana from Nakuru there, of course, giving us that story about the World Rally Championships in Naivasha this weekend. But right here, we want to get you started on that conversation. We told you this morning we are talking about COVID-19 vaccination, the progress that we have made as a country, the gaps that, of course, need to be plugged, and, of course, what the government needs to do in order to accelerate. And we want you to be part of this conversation. We asked you earlier on to, of course, send in your questions, any question that you have regarding, of course, the COVID-19 vaccination in Kenya or the vaccine itself. We will make sure that we answer them because my guest this morning will help us do that. Dr. Willis Akwale is the chairman of the COVID-19 Vaccine Task Force. Good morning, Dr. and welcome to the show.
Good morning, Victor.
Yeah.
Nice to be back here again.
Karibu sana.
Santi.
Some questions are coming up you should expect. And of course, also joining us virtually this morning is Dr. Andrew Were, is the president of the Kenya Medical Association. Good morning, Daktari, and welcome to the show.
Yeah, good morning, Victor. Happy to be here. Good morning, Dr. Holly.
Okay, once again, we want you at home or wherever you're watching us from this morning to be part of this conversation. If you have any question at all regarding the vaccine, issues of safety, issues of progress in vaccination of the population, who are the priority in terms of vaccination, ask all those questions because Dr. Akwale and Dr. Were are here to make sure that we respond to all those questions. You can tweet us at NTV Kenya and at Victor Kiprop _. Use the hashtag #NewNormal. You could also do that on Facebook, Instagram, and YouTube, and we'll surely pick, of course, all the questions that you have. If you're not on social media, our numbers will be below the screen, and you can call in and ask the questions that you will have. But for now, let's get started. Dr. Akwale, it's been, I think it was March, 3 months now. So perhaps we do the daily update to tell people maybe issues of infection and also how many people have been vaccinated in the country. But for anyone who is not aware, how far are we?
Yeah, we've made very good progress. Let me start by saying that our vaccination program began during the first week of March.
Yeah.
And if you remember, our target priority groups were frontline workers, whom we defined as healthcare workers. We included teachers, we included security staff. And we began to what many people viewed as a slow start, but for us it was strategic because one of the most important things is to train healthcare workers properly on any new vaccine that is introduced. And then 3 weeks into the drive, we had the political support. We had high-level, high-profile leaders in the country, starting with His Excellency the President, Uhuru Kenyatta, his cabinet, governors and senators taking the jab, and we saw a very sharp increase in the uptake of that.
That
vaccine.
means there was initially an issue of, fear and some bit of apathy among the people.
Actually, it was a number of factors. The first one, we only began with 1 hospital per county as we trained other people, so there was a slow start. So access was an issue at that time. But as I've said, we were strategic in the sense that we really wanted to train because we didn't want to have wastages or any administration that is not according to the instructions that could also have led to a lot of side events.
Okay.
Yeah, so that one. But also, many Kenyans at that time were asking, how come the leaders have not taken?
Yes.
And that time they were saying, until they see His Excellency the President,
then we can do it.
And immediately he did, yes. There was trooping.
Yeah.
But also we had the third wave that had started. And the elderly people, the over 58, were most affected. So, in fact, immediately we announced that we are spreading to that. They really flocked the vaccination posts. Yes.
And of course, so the question then was, how many people have we vaccinated so far?
So, so far as of yesterday, we've vaccinated 1,200,000. Specifically, 1,201,000 vaccinations have been administered. Out of these, 997 are first doses, and slightly over 200,000 are the second dose.
Okay.
Yes.
That means that only 200,000 people have been fully vaccinated so far.
Yes, so that's what we can now say. 200,000 people have been fully vaccinated.
Wouldn't you say that's a bit of a small figure?
First, it's important to note that we just began 3 weeks ago. We began on the 28th of May.
Second
dose administration. we pushed the second dose administration from 8 weeks to 12 weeks, which was still in accordance to the World Health Organization recommendation.
Yeah.
But you also realize that there has been this global constraints in supply of the COVID vaccines. So we expected 2.5 million doses of AstraZeneca from the COVAX mechanism.
Yeah.
But as we speak now, this did not come. So we ended up having only 1 million doses that we received at the beginning of March.
So in essence, we are not where we are, where we should have been.
We are not where we should have been.
Yeah.
Although when you look at our strategic plan, we expected to vaccinate 1.25 million people by the end of June.
Yeah.
But at that time, we are not factored in the elderly, who are a very big population, 2.6 million.
Yeah.
Actually, immediately they were brought into the priority list.
Yeah.
It meant we have to get 2.6 million more doses.
And maybe before I bring in Dr. Were, this 1.25 was fully vaccinated.
Yeah, that would have been fully vaccinated.
Okay. All right. Dr. Were, good morning. Let me just get your opening remarks to this. Definitely, Dr. Kwale agrees that we have made some progress, but definitely we are not where we should have been.
Yep. I think the Ministry of Health has done a lot in terms of ensuring that most, especially the frontline healthcare workers, actually have access to the vaccine. And I think, as Dr. Kwale has stated, we started well, but I think with the global challenges that you've faced, then there's been an issue of, especially the second vaccines, whereas Kenya Medical Association has received a lot of complaints in terms of both the frontline health workers and the over 58 who had gotten the first part of the public who had gotten the first dose, having challenges in accessing the second shot. Of course, now with this particular donation, I think we need to prioritize this particular group so that they can be able to get the second dose as quickly as possible, so that we do not waste the first shot they did get.
And you mentioned that, of course, healthcare workers were top on the priority list. Would you be satisfied by how many, perhaps, the progress in vaccinating healthcare workers so far?
I can't really say, because it's a mix of things. Because initially there was a bit of hesitancy coming from the healthcare workers themselves. And we had to do a lot of education amongst ourselves to ensure that most of us are vaccinated. But later on, then the uptake became good, and that has led to the rise in demand amongst the health. I think we are not yet there protecting our frontline healthcare workers.
Okay, and maybe back to you, Dr. Kwale. Then I saw a colleague of mine yesterday who had to drive all the way from Nairobi to, I think, must be Muranga to get the second dose. And I think that is, of course, pointing to what we saw last week, the issue of shortage. And you've already rightfully mentioned that it is due to shortage in the international market where we obtain them. But for someone who's watching at home, they're wondering what's going on. Have we stopped production of the vaccines? Why are we seeing shortages here?
Yeah, so these global shortages, there are many factors to it. And we begin with one usually called vaccine nationalism. The people who developed these vaccines, one of the things they wanted is to hold to themselves. This is ours, we must vaccinate our people first and foremost. So that is one aspect, and therefore they didn't start sharing these vaccines early. So, and that is why the rest of the countries, especially low and middle income countries, came together to form the COVAX mechanism that is under the leadership of the World Health Organization, UNICEF, and actually the World Bank, to try and increase access to the vaccines. So COVAX is a great mechanism. However, the other challenge is then the production. So the problem is really not COVAX, but are they also getting the vaccines? And the vaccines then starts becoming, what I've told you, nationalism is one. But also of critical importance is the capacity of the industries, the factories that are there to produce the vaccines. You know, the Western world had almost eliminated all the communicable diseases. So they don't have that huge. So it is in India, part of South Korea and Japan that you tend to get these factories, and they could not just meet the demand. So that's the other factor. And finally, one that many people don't see is the raw materials. many of these vaccines require maybe over 50 raw materials, and they come from very many sources. So, and some of the developed countries are the ones who have some of these materials.
Yeah.
And if they don't supply to the people manufacturing, then the vaccines are not there.
And I'm asking this because quite a number of people are concerned about the issue that, I mean, all the 1.1 million that we received were from the COVAX facility, which is ideally targeting, of course, low and developing countries. And there are those who are a bit concerned that we are a bit over-relying on COVAX.
We had to start somewhere.
Yeah.
First and foremost, remember COVAX and also the African Union mechanism known as AVAT.
Yeah.
These are big, and they had placed orders with the manufacturers, massive orders. So if you went solo as a country and decided I need these vaccines, you are, yeah, and actually here in Kenya we tried. I remember especially when we started realizing we'll have shortages.
Yeah.
And we were being told the earliest we could be on the queue would have been the 3rd quarter of this year. Yeah, that would mean October going to December.
Yeah.
So we made that decision that we will remain in COVAX.
Yeah.
In COVAX, there are two channels. There is where you get the donation.
Yeah.
And the agreement with COVAX is that they will vaccinate 20% of our population, and the government vaccinates 10%.
Okay.
So we remain in COVAX, and we can procure through COVAX. Now, the other mechanism, which we have now adopted, is through the African Union, who also negotiated as African leaders came together to create that access. And it is through there that we've placed orders for Johnson & Johnson, 10 million doses.
Okay.
10 million doses that should start being supplied to us in August, so in fairly a number of weeks from now.
Okay.
So 10 million will cover a lot more than the donation. You see, the donation is going to cover.
Because it's, yeah.
So I think that misconception government is not doing the government really moved fast.
Yeah.
You saw a budget provision for that in this year.
14.3 billion shillings.
Next financial year, but
Yes.
this year 7 billion.
Okay.
And that is what we have used
To get the 10 million?
Yes.
Okay. So this is essentially our plan moving forward.
This is our plan. Now, given the fact that we've seen the utility of the vaccine and realizing that Kenya, the uptake is really encouraging, and that's why many countries are able to give us, we have revised our so-called deployment plan.
Yeah.
And now the target is actually to vaccinate all adults by end of June next year.
So the priority is changing.
The priority coming July is going to change. And it really will change immediately we get the 10 million doses.
Okay.
We want to really ensure all the adults, because this is a disease everybody needs to be protected.
Okay. And that is important. The 10 million is important because the feeling is, I think we've received 350,000 from Denmark.
Yes.
And there was another one, I think 182 from the US next week. And the feeling is it's a bit of a piecemeal kind of, you know.
Yes, and it's just because there are shortages. Actually, what we got from Denmark was a direct donation, government to government. What we are getting next week is through the COVAX mechanism, also called dose sharing, where the countries that have not used, they have been slow to use, or they got access to other vaccines, are giving back to COVAX, and COVAX is sharing these doses equitably across the country. So that is one. And actually, what we are getting next week is not the US one. US just announced 2 days ago. For the information that we have so far, this will be Pfizer. It is not going to be AstraZeneca.
Okay.
So it will be completely, it will target not second dose.
Yeah.
It will target a new cohort of people not vaccinated who will now get a vaccination of Pfizer, which also requires 2 doses, but 3 weeks separated.
Okay. And that is important because initially there was this concern of, oh, okay, there's a shortage of AstraZeneca. Can we get another one and use it as our second dose?
Yes. We do get what you call focus from COVAX every quarter.
Yeah.
And during the first quarter, if we had chosen Pfizer, we would only have got 2,000 doses. They were very minimal within the COVAX mechanism.
But I mean, the question, and I think we'll see this once we start sampling questions that we're being sent, is can we mix the vaccines?
No, you cannot mix. There's no evidence currently that can happen. There are studies, but policies are not made on the findings of just one study.
Yeah.
These have also to be interrogated. There are many aspects of it, and not only even the science itself. Science is going to be important, and yes, it is going to be the key determinant.
Yeah.
But if another vaccine isn't so effective, and remember the cost of administration, then why would you mix and increase the cost of administration?
Okay. Dr. Were, I mean, we are not trying to compare ourselves with the United States or India or any other giant that is already a manufacturer. But if you look around Africa, our peers, do you think we are faring very well? Could we have done better?
I think an honest assessment is we are faring well.
Yeah.
But you can do better in terms of speeding up and having more and more bilateral agreements outside the COVAX mechanism so that we can get more vaccines coming in quickly. As you know, the vaccines even that we're getting, these are delayed batch and nations that I don't know how we'll have handled the issue of the second shot for most of the people who got vaccinated in the initial phase. So I think now that you have a budgetary appropriation for the same, I think Dr. Hwale and team need to do more in terms of going directly and having direct bilateral agreements with these countries so that we can safeguard our people. Because if we target and have they're saying the 10 million doses, that is very encouraging. But we need to get more than that to quickly return to normal. Because the cost of this pandemic, the more we delay, the more expensive it is, both to the healthcare workers and both to the economy of this country.
And that acceleration is important because we really cannot afford to lag behind. You are seeing the hidden cost, the indirect cost of actually lagging behind. You're starting to see regions where you can't travel if you're not vaccinated. So that means there are costs to lagging behind into our healthcare system and also to our economies.
Yes, the indirect costs, and if you look around and how, and this has an impact on the overall health of the population.
Yeah. Because
at the end of the day, we are seeing a lot of mental health issues coming up because of this indirect impact, because of the difficulties people are finding having just meeting their daily needs. So, and that's why we think that we really need to get out of this. Most countries, other countries have done it. We have seen it in Israel, in Seychelles, which is in Africa. And I think Kenya, being a bigger economy, can be able to actually pull up its stocks and accelerate this process of having everyone vaccinated. I think it's encouraging that now we are moving beyond the over 58 and the healthcare workers, and we want to vaccinate each and every adult by June next year. I think that is a very encouraging move. But what we need to do is do less of planning and then implement more so that we can resume our normal lives.
Okay. Dr. Kule, let me take you back to the target that we had for this vaccination initially. I believe it was to reach 60% of the adult population in 30 months. I believe that was from March, March this year, 2021. So if we can't, first of all, do you think this, given the progress that we made, was this some bit of a too much of a tall order, or are we still on course?
It was well informed. It was informed by that time the fact that we anticipated the global shortage.
Yeah.
In fact, for us, we saw a hump between June, July, and part of August. And after that, we are likely to start getting. Remember that time we had only 3 WHO pre-qualified vaccines. Now, I think we are talking of 6. We have the 2 Chinese, Sinovac and Sinopharm.
Yeah.
We have Novavax that also has got that approval. And they are quite a bit.
I've seen something called Abdallah from somewhere. Is it Cuba?
Cuba has also come but it will have to be presented to WHO.
Yeah.
Remember, these vaccines are more or less undergoing what you see. They are being given emergency use, meaning that they have been shown to have a lot of benefit more than the harm, but you still have to have regulatory approval.
Yeah.
And that is why, as a country, we are very keen that they have WHO listing, in the sense that we want to assure quality, we want to track any rare side events that may be happening. So the ones that have WHO listing is what we want to. So we saw August as that period, and then we should start seeing an increase, and that is what has informed the decision for us to now even target more people.
Yeah.
The other thing is the mechanism through the African Union. Johnson & Johnson has made a decision to produce the vaccine through the plant in South Africa, I think called Aspen.
Yeah.
And the decision is that 50% of the doses produced there will actually remain on the African continent.
Okay.
Yes.
Okay, and that is pretty much very important, because then the question among all these other people, and everyone is worried, I mean, as we wait for the US to kind of vaccinate its population and remember to send the remaining ones to us, why don't we have the capacity as Africa to do these things?
We do, and let me assure Kenyans that already Kenya has taken steps, and we are now work in progress towards human vaccine manufacturing.
Okay.
And it started from the realization that Kenya is already manufacturing veterinary vaccines. We have an institute known as the Kenya Veterinary Vaccines Production Institute that has been producing vaccines from 1990s, especially vaccines for foot and mouth diseases. And we actually export some of those vaccines across the continent.
So we do have some bit of background to this.
Yeah, we do have. And therefore, the government formed a team that is led by the Kenya Medical Research Institute under the chairmanship of the board chair is Colonel retired Dr. Daniel Mbinda. I am a member of that team, and the very first thing was to develop a concept note, which we've done, and then define a business. We've identified a facility within Embakasi in the industrial area.
Yeah.
As we speak, we've requested the Ministry of Works to assess so that it can be refurbished. But our plan is to partner with already groups that have WHO pre-qualified. We want to begin with what they call fill and finish, where the like Johnson & Johnson or AstraZeneca or Pfizer, who already have a vaccine, can come and they bring them in bulk, and we are able to now start putting them in ampules and vials to distribute in the region. And during that time, then we are pushing for technological.
For those of us who don't understand, perhaps that's like the last process.
Yeah. It's the last process of the production, but a key one, because even some of the plants in Europe are actually fill and finish. There are very few full production human vaccine facilities globally. Okay.
Maybe as a doctor, Dr. Were, why are we lagging behind in terms of the issues? Are we not investing in research as adequately as African countries?
Yeah, I think if you look even at allocation for research from our budget and to NACOST, I think it's not enough, and we are not encouraging, even from our universities, we're not encouraging a lot of research, local research to come out, which can help us in development of these vaccines. We also need to have an environment that is created that is conducive for these local scientists to be able to work. They are supported so that they can be able to come up, because if you look at the capacity of Cambridge and what it can be able to do, I think the issues of production of vaccines, we should have done it a long time ago. And this pandemic has shown us that as a country, we need to actually boost our own production. So I think it's upon the government to invest and to trust its own scientists. If you look at all over the globe, Kenyan doctors and scientists are globetrotters, and they're doing very good work. So I think these are resources that can tap, bring them home, and develop our country from within.
Okay. Dr. Akwele, do we have like a target of when we can perhaps see that, even that process that you're talking about?
The first phase, we've given it 9 to 12 months.
Okay.
Our committee was constituted sometimes in April, so we began work in May. We are just doing our, more or less, finishing our second month.
Yeah.
Our target is that 9 to 12 months, the fill and finish form should be up and running. And then 2 to 5 years, we are going to go into complete human vaccine manufacturing. We are targeting certain vaccines, even among those used in children, like polio, which have no patent. So it is not going to be a very tall order, but the overall infrastructure and equipment. And the subject we are talking about, research and development, is actually our third kind of pillar. And that is why KEMRI was chosen to lead this. And the idea is that KEMRI will be the one actually doing the research and development, even if we get the partners the big pharmaceuticals joining us.
Yeah.
The research arm will remain within KEMRI.
Okay, and that reminds me that now we have the issue of the fourth wave and the third wave and whatnot, where we are, and there have been concerns that now that these variants are said to be kind of mutating and all that, will these vaccines be still effective against these new variants?
Yes, so the encouraging thing is that even if you look at the data coming from the UK, who have mainly used AstraZeneca,
yeah,
they have actually found that it is effective against the Delta variant. And other data also actually being analyzed. I think that fear that it may not is not. And I think the engineering being put into these vaccines, especially the messenger RNA vaccines like Pfizer, Moderna, and others that may come, it may be easy to always try to be ahead of the variants, but we are not yet there.
Yeah.
I think what is important is a very strong monitoring to know the impact of vaccination on any population, whether it is one variant. Remember, we could also even get Kenyan variant coming up. There could be many other variants.
Okay.
So it will always be important, and then we monitor the impact of vaccination programs within our continent.
And I'm asking that because in Nyanza region now we have what I believe should be the Indian variants, and it's really bad.
It is bad, and for me, you know, when we started vaccination, I kept monitoring the uptake. The uptake was high in Nairobi, Nakuru, were they called the red zone areas then?
Yes, which was closed, I believe, between April and I think in May, yeah.
And I used to look at data coming from highly populated areas in Western, and I could see they are number 10, number 12 in terms of uptake. But believe me, when it came to the second dose the other day, I saw Kisumu used to be 10, 12.
Yeah.
Now it's third. It was third, second and third.
In terms of
uptake
of the vaccines.
Now people are going for it. So it's like Kenyans, until you really see the danger is when you run for shelter.
And that reminds me then that the frontline workers here are the healthcare workers dealing with this deadly variant. Maybe Dr. Were, you can comment on that and the importance of vaccinating and ensuring perhaps those medics who are working in this, disease, they would call it disease-infested area in Nyanza, are actually prioritized.
Yeah, I think with what we are seeing from our colleagues coming from Nyanza, actually, first of all, there's an issue of adequate PPEs, and other than that, also the issue of vaccines, them getting the second vaccine shot. So I think it'll be important for, especially that other region in Western part of the country, for those healthcare workers to be given the first priority in terms of them getting the shots, because we know the numbers are high, we know they're more exposed. So we need to ensure that this is protected first during the deployment of these particular vaccine. And I'm sure Dr. Hwale and his team will be able to consider that, because it's important to protect these frontline healthcare workers. We cannot afford to lose any more of them. And that's where I think we need to focus for now, to ensure that at least everyone has gotten the second shot from that particular region.
Okay. This 350,000, Dr. Akwale, where are these vaccines going? Are there like areas we are strengthening that a majority of it is going?
You see, what informed distribution of the doses was the uptake of the first dose. Because remember, our priority is second dose. So we looked at the uptake for the first 6 weeks. That was March and part of April. Yeah. And that informed us where we take. So you'll see Nairobi had a very high uptake. So we distributed in the 9 regional stores. So you'll see, for example, Nairobi got 172,000. Yeah. And Nairobi also serves Machakos and part of Kajiado and Kiambu, actually. Okay. Yeah.
And that is important because I'm just looking at the math. 997, that's the people who have received their first dose. 203,000 of them. So that means it leaves out with, I think, 700,000 who still need the second dose, right? And we have just 350 and I think 358 and the 180 that we are expecting. It means that there people will be left without receiving their second dose or something?
We still have a gap, let me say that. But let me, you are right in terms of your mathematics. Yeah. We have now done 200,000. Yeah. We are getting 500,000. Yeah. that is the 300 and the
Total,
182.
Yes.
So basically 700,000 of a million. So we have 300,000 a gap. It may become smaller in this way. We've been looking at our data and we realized that because of the training and I think because of the huge turnout of people for the vaccination, the wastages were much, much minimal.
Okay.
Globally, a 10% wastage of the doses issued is acceptable. And at one time we thought maybe we'll have wasted that.
What do we mean when we say wastage of the vaccine?
Wastage is, wastage of vaccine, and an important thing for me to actually, you see like AstraZeneca, the vial has 10 doses on average. But you could occasionally get up to 12 doses. Although some vials could also get to 8, but on average 10. Now, when you open that vial, then you must make sure you have 10 people
ready to be vaccinated.
Okay. But in some area remote where turnout is low, is you may find you've opened and 7 people turn up.
So 3 have
to be wasted. After 6 hours, you have to discard it.
Yeah, and I've actually remembered that there was an issue about the shelf life of the vaccines that we're receiving from Denmark. So I think it should be by the end of July when that's when they should we should have already perhaps used it. So looking at the vaccination rate, do you think we will have done it by then?
Absolutely, absolutely. This country has a lot of capacity. It has a very advanced immunization program that has a lot of experience. Secondly, the demand is there. Remember, at this time of a second dose, these are already people who got the first one, and they are so eager.
Yeah.
If you sat on my seat last week, you would have first switched off your phone because everybody was calling and asking where is this second dose. The demand is there.
And I'm asking because then if the people are interested, and I think it must be the PS who mentioned that we have, and you also mentioned that we have the capacity to vaccinate 50,000.
Yes.
Is it in a day?
But
we're not doing that.
And I'll explain that. Actually, during the very first dose, the highest we reached was 48,000.
Yeah.
Our plan was initially to use 658 facilities, both public and private facilities. But because of immediately we realized the shortage is there, we prioritized the use of 200. Okay. And it is with these 200 facilities that we are able to actually vaccinate the numbers we are seeing. So once the doses, we get adequate doses and we spread through the 600 facilities, we will even be able to go beyond 100,000 per day. So why we are not doing that is just because of the constraints in supply. So we are not fully utilizing all the 600 facilities. But with this distribution, we've talked to the counties and we've asked them to make sure we fully utilize, especially the almost 200 facilities that are ready to vaccinate.
Okay. Of course, remember we will be taking, we'll start taking the questions that you've been sending us. So keep sending them, and Dr. Akwale will be responding to them alongside with Dr. Were. But Dr. Were, you mentioned earlier a big issue, by the way, initially when we began this vaccination thing was the hesitance among the people. And I think you actually mentioned even among healthcare workers. Has that changed?
Yes, I think initially because there was lack of involvement of healthcare workers as key stakeholders in this vaccine issue. They are not properly involved. But I think then through education and through bringing them on board in the various issues concerning the vaccine, we have seen increased numbers. And as we spoke, I told you that actually most of the healthcare workers are calling and asking where they can get the second shot so that they can fall within the recommended period for getting the second shot. So the hesitancy has decreased. We're seeing more healthcare workers, and I think this has been informed by the kind of mobility and mortality data that we're getting. And I think then everyone has taken the initiative to have him or herself protected.
Okay. Dr. Akwale, yes, you want to respond? Yes.
Yes, let me add something about the issue of hesitancy. And hesitancy is a complex subject. The issue of what you want to call complacency is one factor. There is convenience and there is confidence. What Dr. Were has really talked about was people are a bit complacent at the beginning and they are wait to see. But there was also lack of confidence. What will this vaccine do? There was a lot of misinformation. And I think that also got addressed. The issue of blood clots, remember we spent weeks really explaining to the people that even COVID itself as a disease causes blood clots. And it was not just unique for AstraZeneca, and I think WHO then pronounced itself very clearly that that's an extremely rare event. and the benefits outweigh. But the other one is convenience, and that's the one we've not looked at. When we began, even here in Nairobi, I think we began with only 6 hospitals. Most of the healthcare workers work away from the main hospitals.
And you're asking them to
go to that one
kilometers.
hospital. So it's until we started taking the vaccines closer to them that an uptake also increased. And you can be sure when we have adequate and they're in all, because if I'm working in a remote area and I'm the one who is waiting to be vaccinated, I expect the vaccine to come to me.
And I think that will apply even to the public, because if you're asking me, like the colleague I mentioned, had to drive to Muranga, how many people can drive to Muranga? But if you tell me that in my dispensary in the village, or my at least the main hospital, it will like change the game.
Yeah, absolutely.
Okay, and this reminds me of something else then, that initially we said this was meant to be, I think, healthcare workers, I think the teachers and the security. And no offense to this question, everyone deserves to be vaccinated. But after a while, we realized that there was just a call out for anyone. If you want the vaccine, you can go to Cambridge. Talk to us about the logic behind that.
Let me say that our priority remains that, our policy, our direction is that.
Yeah.
Vaccination as a program also has certain experiences you get out of it. If you are too restrictive, you will again waste.
Okay.
If you become too restrictive and people have shown up, they can also lose confidence in the program.
Okay.
So we stick to the priority, but we also say don't be too restrictive. You see, like I was explaining, like now our priority is second dose, but in some remote areas, you've opened the vial and somebody shows out for the first dose.
Okay.
What will be the better, Devo, to give them that one shot or discard it anyway after 6 hours?
Okay.
Yeah. So we are not absolutely restrictive, but we would like to get order so that those who are prioritized really are in front of the queue.
Okay, and maybe then with this coming vaccines, the 10 million one, who is the priority going forward? Does it remain the healthcare workers? Will we see perhaps other concerned members of the public who've been looking forward to this get their chance?
Yes, absolutely. We believe that especially as we finish this first phase and everybody has a second dose, I looked like for healthcare workers, I think we were at 81% for first dose administration. And even for the second dose, they are the majority. I think almost 40% of those administered so far.
Yeah.
Now, there's a priority group we've left, and I really need us to address it.
Yeah.
Immediately we start getting the doses. These are people with chronic diseases,
yes.
And they are above 18 years. And they are not above 58 years. So between 18 and 58 years, you have diabetes, you have hypertension, you have sickle cell, you have... These are a real priority. And we are trying to really advise that we may need a special way to reach them.
Yeah.
Many of them attend special clinics within our facilities, referral facilities. So ensuring that when they go to be assessed, they get vaccinated is a strategy we are going to really recommend that we deploy. And they will be among the very first ones we really want to target as a group.
Okay, wonderful. And of course, we asked you to be part of this conversation, to send those questions that you would want my panelists this morning, including Dr. Akwale, to answer them. Maybe we can take a few of those questions now as we prepare to go for this commercial break. Yes. Some of the questions that you've been sending us. Someone is asking, I would like to know, is it normal on trials, other vaccines for COVID-19? What are some of the side effects which are likely to happen to those taking the jab, short and long term? Thank you, Samuel. We've taken note of your question. That is the issue of side effects, short and long term. The people asks, are there any clinical research or COVID-related social science research being done in Kenya? If so, where can one get the output? I shudder to think that all our universities and governments are simply waiting for answers from the West. So are there any clinical research? Okay, that is the issue of clinical research. And the last one, Rogers is asking, who are more vulnerable to COVID-19 in the community? Who are more vulnerable to COVID-19 in the community? What, with this type of COVID vaccine, which one can be given a single dose, please? That is, Rogers is asking the issue of a single dose. We have to take a quick break, but Dr. Willie Sakwale and Dr. Andrew Were are staying with me. When we come back, we answer all of your questions. Keep sending them on social media, on Twitter at Victor Kiprop and at ATV Kenya, and use the hashtag #NewNormal. Don't go too far.
Weka Collabo na Shell, Shinda Fuso FI is back and bigger. Weka Collabo na Shell Fuels plus Shell Lubricants, Africa's Oshopata convenience shop. To enter the draw, dial *384*200#, enter the code from your voucher and follow the prompts. Terms and conditions.
Introducing Kwetu Mix.
Okay, but don't need no intro.
Tangu tuingie kwa mchezo sindo heartbeat. Nairobi City tunairan kama athlete.
If you know, you know.
We have a banger.
Ni show, ni wapi uliniona?
Kwetu Mix on MTV.
Tutakuletea updates zote about all the trendy and popular entertainment events.
Yes, bana. Ini vibe ya kibazu na form iko true.
Bazu, big man, bazu. Bazu. Ni ufanya biz na mabazu. Join me, Ted Agwa, right here on your favorite channel.
Hatuna maneno kukwetu, tunapendana kikwetu.
Kwetu Mix on MTV.
You know what? I've always been a hip-hop head. Yeah. Like, I literally don't know how else other people are.
Just about 10 minutes until the top of the hour. That conversation continues for...
I was raised on MTV, then it turned into VH1, turned into Trace, Channel O. Like, I've been through
Channel O, yes, we have something in common.
So to clear up the air to a meaning, what's the meaning behind your phrase?
Tunaifanya leo si kesho.
We do it today na tomorrow. Leo. Hata saa hii.
Jo. 5-8. Kwa nini kesho? Si kesho. Acha kumisuse kwa nini kesho. Hiyo ni heavy word.
To report gender-based violence, call the toll-free line 1195, download the Komesha the Luma app, or dial *483*306#. Kuwa Bazu True.
Invest in the prime plots from Finca Properties Limited, Equator Gardens Nanyuki, a gated community ready for immediate development. We also have Konza Suburbs, a gated community within Konza Metropolis. For details, call us today. Finca Properties Limited, prime and affordable.
Thank you for staying with your world on NTV this morning. We are talking about the progress of COVID-19 vaccination in Kenya. So far, just over 1 million people have been vaccinated, 997,000 of them being people who have received the first dose. but only 203,000 people have received, of course, have been fully vaccinated. So are we lagging behind? Does the government actually have plans to accelerate this? And of course, we answer all this and any other question that we will send us. And remember, it's now time to answer all the questions that you've been sending us. Earlier on, we asked you, what question do you have regarding, of course, COVID-19 vaccine or vaccination in Kenya? What questions do you have on the COVID-19 vaccine or the progress of vaccination in Kenya? Send them at NTV Kenyan, at Victor Kiprop _ on Twitter. Use the hashtag #NewNormal. You could also do that on Twitter, Facebook, and Instagram. And if you're not on social media, that is no excuse. You can call in on the numbers below your screen in a short while and ask your question. Dr. Willis Akwale is the chairman of Kenya's vaccine task force. Is also with us this morning, as well as Dr. Andrew Were, who is the president of the Kenya Medical Association. And Dr. Akwale, before we went for that break, we had taken some questions, and I think the first one was regarding the issue of side effects of the vaccine, both short-term and long-term.
Yeah, thank you very much. So as these vaccines undergo the clinical trials, what happens is that there's a listing of any side effects that are experienced.
Okay.
And even including what may have been experienced in animal models. Remember, you begin with animals, then you come to the human. So by the time of emergency listing, you are given a whole list. And many of them will start from pain at the injection site.
Yeah, I've had a number of people who've talking about
Yes, there are people not used to pain. Yeah, so that's a side effect.
Yeah.
A rash and swelling around that place could be another one. Headache is very common. A number of people will run fevers.
Yeah.
Those, and many of these will basically subside within a period of 24 to 48 hours.
Okay.
But there are certain ones where we pay a little bit more attention because they could have a bigger impact.
Yeah.
And especially the ones that touch on what you want to call musculoskeletal system. That is like the walking, the limping. People may tell you they have numbness in the limbs.
So that is a concern for anyone who has...
Yes, that would be a concern, and even for the regulator, because you want to suit that. A few of that have been reported in Kenya. I remember one that took 4 days.
Yeah.
Somebody was like, I can't completely move my limbs, but after 4 days, they were able to walk, and that subsided. So there will be others we pay more attention to.
Yeah.
However, any side event is supposed to be reported, and there are 2 ways of reporting this. You can report to the facility where you are vaccinated, and the healthcare worker can report that, or you can directly report yourself to the Pharmacy and Poisons Board.
Okay, and that's important because initially there was the issue of reported blood clots in the West. Has that been seen in Africa?
I think overall in Africa they have been extremely rare.
Yeah.
Here in Kenya, I wouldn't say we have, but we've been investigating.
Yeah.
Alleged, and there's a team that does the investigation.
Yeah.
And when they find that really there's no linkage, then usually they do a final report.
Okay.
But we are monitoring that.
And I think the last part of that question, the issue of long-term, could also be implying, because there were also concerns that it could affect issues of reproduction.
Yes, and if for those people, I think this week there's been a publication where people have looked at the sperm count following vaccination. And the good news, there was no impact on the sperm count at all following in the short term. So you are still okay.
Yeah.
But what is important, yes, in the long term, we will continue having that monitoring.
Yeah.
And it happens with all health products, not only vaccines, that you continue having a system where if there's a very rare side effect, then you need to report that to the regulatory authorities.
Okay. So if you are concerned on that, at least for the moment, you can breathe in, right?
Yes, absolutely.
Okay, let me allow Dr. Were to take the next question, because it was about something he had touched on earlier on, and you can also respond, Daktari. The issue, I think, was about clinical research and whether, as African countries, we are investing enough, and whether our research centers and even universities are doing enough, or are we just waiting for all the answers from the West?
Yeah, thank you. I think the other day in the news, we saw what the meeting that happened in Nigeria, where the University of Nairobi was incorporated into an initiative to actually fast-track the development of manufacturing of vaccines.
Yeah.
So I think a lot is being done. the issue is we are publishing in foreign journals and not publishing locally for consumption by our own population. But I can tell you, even in the Kenya Medical Association, we have some of our scientists, and even in Kenya, who are actually doing a lot of research. And I think it's just been 1 year, almost more than 1 year since the pandemic started. And I think towards the end of this year, you'll see a lot of papers being generated by local scientists. So we are not waiting for the West.
Yeah.
I'm aware that we are doing a lot locally.
Okay, do you want to touch on it?
Yeah, the only thing I can add, I think research must quickly move into market and into actual utility. It is true that our researchers have done a very good job, but the experience I've had chairing this task force and hearing and seeing what is happening globally is until such a time that we also know that we must quickly move the products that we research on into use, and therefore skills into the area of marketing, product development, marketing. So the partnership you require to do that, there are organizations that are very good. That is not a skill that maybe research institutions will have. So how do we partner with the private sector to ensure that then they are able to do this marketing and get product? And the other partnership that is key is with regulatory authorities so that the products meet the World Health Organization standards and other global standards.
Okay. The last question before we take the next set of questions was about who are the most vulnerable groups in the community and whether there is a chance to get a single dose shot.
So we look at it in two ways. There are those at risk of infection and there are those at risk of severe disease. So the reason we targeted frontline healthcare workers, security and others, they are at risk of being infected in their line of duty. Then there are those who are at risk, and we've seen that those who are elderly are at risk, those who have comorbidities and underlying medical conditions, let me call it that, things like hypertension, diabetes, heart conditions, other ailments, cancer, they are at risk of that. So, and the young people are least at risk of this infection. On the second question about single shot, Johnson is the first one that has been approved as a single shot. And it has already got approved. And part of the reason Kenya has prioritized that is to reduce the logistical costs of vaccinating such a big population. So yes, wait for it. It is going to come, but if you are due for your second dose, please take your second dose of AstraZeneca so that you are protected. Don't say I was waiting until that one single shot comes to Kenya.
Okay, let's take the next set of questions now that you've been sending us on Twitter, on social media. Yes, we have Mo Shadrack says, suppose I don't go for the second dose, what will happen? That's a very important question. Suppose I don't go for the second dose, what will happen? Let's get to see another one. Yes, and Faiz says, has the government spent any funds to buy vaccines, or are all vaccines donations? Okay, yes, both questions are very valid. And then the last one, I think, is from Anne, is that can you mix jobs? And I think we have responded to that one, so we can take the first two.
Let me start with the first one, which was...
The first one was about if I don't take the second dose.
If you don't take a second dose, we told you that the first dose gave you what we call partial protection, and by that we mean you generate an immune response that does not fully cover you, but it gives you anything up to 70% protection. And then within the period recommended 8 to 12 weeks, you get a second jab. It actually improves that protection to what we now call full protection, and once you have full protection, you have the full benefits of what has been seen with the vaccines. You have, in terms of severe disease, you are fully protected. In terms of transmission at community level, there's now evidence of that reduced. Now, if you don't take your second dose, the data shows at about 15 weeks, if it is AstraZeneca, then you start losing the antibodies, so that you are no longer going to be even having them, so that when you give a second dose, there's a better response. So you will lose the protection that you had
in the first.
So
that means you have to complete.
You have to complete, and what is important is the duration of protection. Remember, the first dose will protect you. First, it becomes effective almost 3 weeks after that. and it protects you, as we can now see, almost up to 4 months.
Okay. And if, so for instance, if I don't take, because I noticed the government was revising the period. So at first it was 8 weeks before you take your second, and then we revised it, I think, because of the shortage. If I don't do it at all and I lose the protection from the first dose, do I have then to start afresh?
We are going to pronounce that. In fact, that's why we are monitoring. If you look at our daily brief, we are very keen on what we call second dose uptake. I think as of yesterday, it was 20.8 or something %. We want to be sure that everybody will get vaccinated.
Okay.
You will see that the other thing we've done is through the chanjo system, we are scheduling those that are due for 12 weeks. And by the way, the reason for 12 weeks is, first, it is recommended by WHO. It was recommended even before the shortage.
Yeah.
We initially chose 8 weeks because we had been told more vaccines were coming and we wanted to scale up.
Yeah.
But with the shortage, yes, we extended that to 12 weeks. So if there will be those that will not at all get, we are going to give them the professional advice as to what they will need to do.
All right. And maybe at this point I can ask Dr. Were, because you, as medics, you deal with the patients every day. Do you actually, you know, try to encourage them to take this vaccines, especially for those who are a bit hesitant?
Yeah, I think for, as Dr. Ahwale has mentioned, I think our worry as medics is actually those patients who have comorbidities, who had not been factored. And these are the ones that, of course, we told them most of the time to isolate, wear a mask, practice social distancing. But now with the coming in of the vaccines, then these are the ones that we do actually advise, if they can, to actually go and get the shot. And most of them have done. Actually, they're above 58, which I think was a good thing for them.
Okay.
And we continue to urge people and address this issue of hesitancy and the myths, many myths that are circulating in terms of what the COVID vaccine can do to you if you take it. So we as medics are playing our part in terms of education of the public.
Okay. And then maybe back to you, Dr. Akwale. Then the other question was about if government as at all put any money into vaccines, or are we just waiting for the donation? I believe.
In terms of procurement, I've said we have ordered the 10 million doses that will vaccinate over 10 million Kenyans. There's also good news that the Johnson & Johnson will reduce the price. They have actually indicated to us with the same cost we may get 13 million doses.
Okay.
So the government has already put money in direct vaccine. But remember, in terms of programmatic, the distribution, like now the doses we got recently, that distribution, the training of healthcare workers, the system that we are using, there are a lot of indirect costs that the government has ensured that this process goes on smoothly. We are also increasing, the government is also increasing investment in terms of communication.
Okay. And maybe at this point, but anyway, I'll come back to this question about the cost later on. But let's just take yet another set of questions that you've been sending us. And by the way, if you also want to call in and ask that question, you can do that. The numbers will be on the bottom of your screen shortly. We have Jen who says, what if COVID ends and I haven't been vaccinated? Am I still at risk? Okay. That's a very, that's an assumption that we are assuming COVID will end. And then Ruth is asking, why are hospitals selling the vaccines? Okay, we'll try to confirm if actually that is true. But you can respond to, first of all, the issue of not wanting to be vaccinated at all. What if I don't want to? Because I think the government was clear. It's
voluntary. It remains voluntary.
Yeah.
You make an informed decision yourself. We've given all the information so that you make that decision. We've told you what it does. And I think many Kenyans have now had an experience with people who have suffered from COVID. So it's always good to make the right decision so that if at that moment you are on oxygen then and you are asked, did you ever get vaccinated? Then you actually made a decision on your own. But the thing about when will COVID end? Oh, we pray it ends. Yeah, that would be a very good thing. I mean, we would all really celebrate.
Yeah.
But if we look at the history of respiratory viruses, including the Spanish flu of 1918, we are likely to move from what you call pandemic to it becoming endemic. There will be so many variants, and they will. So you see, the Spanish flu is now what we call influenza A.
Okay.
People get the flu, and it subsides with time. But before we reach there, it can be catastrophic. If we look at the Spanish flu, and when the second wave came and people had dropped their guard, it's when it killed most of the people. So at this time, we must really be on the guard. I don't think anybody should be thinking about COVID ending very soon.
Okay. The other question was about whether hospitals are actually selling these vaccines.
We have been getting reports to that. That's unfortunate. That is unacceptable. That cannot be allowed. We are in a pandemic, and nobody should profiteer from people suffering a pandemic. People who have lost jobs, people who have lost loved ones, people who have gone through the disease. The vaccines that have been brought here, whether they are administered through the public health facilities or through government facilities, are absolutely free of charge.
Okay.
And we've urged Kenyans that if at any point you are asked to pay for that, kindly report it to the nearest administrator and bring this to the attention of the police as well.
Okay.
No vaccine should be sold.
Dr. Were, let me just get your view on this, because initially there was some bit of a concern, and maybe that, you know, now that maybe the progress is taking too long, can we sort of commercialize it and allow Dr. Were to import for himself and sell it to his village?
I think the issue of commercialization of this vaccine is something, as an association, we came out very openly about it because of the public damage that you can do when you decide to sell vaccines. Dr. Wale has put, I think, the government position to sell these vaccines. However, as a private sector, we've seen in the American market, we have a very big role to play in terms of deploying. You can tap on the infrastructure in the private sector to ensure that majority of the population is vaccinated. So I think where the private sector can come in to support the government in ensuring that these vaccines actually get to the intended target. But the issue of selling them, the actual vaccine, then I think that is not morally right. What can be charged is actually the cost of maybe administration of the same vaccine. But selling the vaccine itself, I think, as Dr. Wale has put it, it's not the right way to go as a country.
What's the risk, Dr. Wale?
The risk of?
Allowing Victor Kiprop to import the vaccine on himself, by himself, and maybe vaccinate my village and my estate.
The first one is regulatory. These vaccines have not got full market authorization. They are not just any other product. That's number one. Number two, they are supposed to undergo very stringent regulatory monitoring that has to be reported. Remember the side effects. So you have to monitor right from production, the batch number, and really report to both the pharmacy board here and the World Health Organization on that.
Okay.
Now, the other one, which is very critical, is that if everybody is just allowed to bring any type of vaccines, the vaccine world, even before COVID, has a lot of black market. There are a lot of counterfeits, and you will not know who is vaccinating what. And the risk the country then stands is that it could also be blacklisted as a country where we don't know what these vaccines are all about. And therefore, the certificate that would be issued would be really at risk of recognition.
And I'm asking that because it's this famous statement by the minister himself, Honorable Mutahi Kagwe, talking about you could even be being vaccinated with water.
Yes, absolutely. Of course, there are few conmen and fraudsters out there giving up certain numbers, telling people come and get vaccinated and charging.
Yeah.
The good news that at least one of them has been nabbed, and you may hear that coming, but the police are in pursuit of such people because we really don't know. Don't think that anybody who tells you they are able to give you a second dose, they are giving you the right thing.
And that means you should do this in the correct, authorized, of course, facilities.
Yes, absolutely.
Yeah.
We have listed those facilities. I hope, again, we are going to list them so that you know where to go for your second dose.
Yeah.
We'll be working with our communication team so that we, again, tell Kenyans where to go for these vaccines.
Okay. Speaking of which, we have a caller. I believe that should be Mwangi in Nairobi. Good morning, Mwangi. Do you have a question or a comment regarding our discussion on vaccines?
Yes, this is Mwangi. I thank you for the good job that you're doing. My concern,
Yeah.
In as far as the second dose is concerned,
Yeah.
Either there is a breakdown between the government and the centers that are giving the vaccine. Because yesterday I went to Eastlands, Makadara.
Yeah.
I also went to Umoja.
Okay.
And both of them, both the centers did not have the information when they are going to get the vaccine.
Okay.
I don't know how best the government can, either possibly they announce it through the media,
Yeah.
that these centers are going to get the vaccines on this and these days.
Okay.
Because like now we wasted a whole day yesterday trying to get the second dose of vaccine.
Okay.
So I wish there can be a good way of communicating.
Okay.
So that we know what is happening. Otherwise, you're doing a good.
I'll allow Dr. Akwale to respond to your question. Thank you. That is Mwangi from Nairobi, and maybe you can respond.
Yeah, we are going to improve. We are going to do better. Let me say some of these kind of mishaps and misinformation is a lot because of the shortages we've been experiencing. Let me say like this second dose. Okay, just before we received this, actually we hardly had 5,000 doses left and across the entire country and very many facilities. Nairobi 0. There were no doses. Now we received them on Monday.
Yeah.
They go to Kitengela. They have to be repacked for redistribution across the country.
Yeah.
So that happened a lot of Tuesday. But the good thing is that we were able to send to the regional stores, including Nairobi.
So where are these vaccines right now in the regions?
They're in the regional. We have 9 regional stores. In Nairobi also has a regional store.
Yeah.
Not Kitengela, but the regional store is near Kenyatta National Hospital. Now, from there, the counties start drawing. But we have guided them depending on how they vaccinated first.
Okay.
So today is Thursday.
Yeah.
A lot of the counties started receiving the doses yesterday.
Okay.
Most likely late afternoon. There's a way in which they must also account for previous doses.
Okay.
So I expect today a number of them should have start vaccinating.
Today, okay.
Yes.
So that means beyond tomorrow, literally every should be able to access. Wonderful. We have Zach from Kikuyu. Good morning, Zach. Do you have a question or a comment regarding this discussion? Zach? Okay, I think we've lost Zach there. Please call us back, Zach. We want to make sure that we respond to the question that you had, of course, regarding the issue, of course, of vaccination. And maybe this gives us a chance to maybe clarify on that, the issue of the nine. So from these 9 centers, it's upon the county governments who are in charge of the hospitals to come and pick them.
Yes, it's the county governments to go and pick them.
Yeah.
County government to support actually sub-counties. The important thing is that the vaccination occurs at sub-county level. So the county government ensures the vaccine reach the sub-counties where the facilities are.
Okay.
Yes.
All right. Wonderful. That is indeed very important. And one last concern that I also had regarding the issue of the people who are being vaccinated, we are still yet to start vaccinating children.
Yeah, because the vaccines that we have do not have regulatory approval yet to start vaccinating people under 18. Pfizer, I think, allows up to 16 years. But now in the US, there's data that is confirming you could go up to 12 years. But that also has to go through WHO for us to adopt also as a country and also through our pharmacy board. When that happens, and that is why we are strategically trying to get 30 million doses.
Yeah.
26 million will take care of the adults, and we believe 4 million will be when approval for children comes in.
Okay, wonderful. We have to take a quick break, but of course, we still have, of course, to answer all the questions that you have, whether you're calling in on the numbers below your screen or you're sending your questions on social media. Dr. Akwale will still be with us to, of course, respond to those questions, as well as Dr. Andrew Were, the president of the Kenya Medical Association. Don't go too far.
Ni StarTimes. Get connected today for only $9.99 aerial decoder and $2,699 satellite dish.
StarTimes. Enjoy digital life.
Malaria ni ugonjwa hatari sana unaoua watu wengi hapa Kenya. Japo kuko na corona, hatari ya malaria bado iko. Mtoto huyu alikuwa na joto jingi, kutetemeka, kuumwa na viungo na uchovu. Alikimbizwa hospitali ya umma ambako sheria za Covid-19 huzingatiwa na ni salama kwa shughuli ya upimaji. Vipimo vilionyesha kuwa ana malaria na papo hapo daktari akampa dawa za malaria na kumshauri azimalize, na ili kujikinga wawe wakilala ndani ya neti iliyotibiwa. Malaria husambazwa na mbu. Walio hatarini ni watoto wa chini ya miaka 5 na akina mama wajawazito. Kupimwa na kutibiwa ni bure katika hospitali zote za umma. Usisahau adui malaria. Zero malaria huanza na mimi. Chukua jukumu leo. Komesha malaria. Ujumbe huu umeletwa kwenu na Wizara ya Afya.
Fresh fried ginger has ginger oil, which is good for a healthy living lifestyle. It combines wonderfully on salads, stir fries, when basted on roasted meat, or simply sprinkled on your favorite dish. Now available in 250 ml, 500 ml, and 1 liter.
The World Athletics Under-20 athletes are the next big names in sports.
Is astonishing.
Be part of their growing pains and glory in wins.
One of the great Olympic moments.
A new world record. It's been obliterated.
Witness greatness in the making live on NTV.
And a fantastic finish.
Setting the pace for the nation.
Let me tell you something, my friend. When I was still in school, I was the very best when it comes to English. Yes, grammar, I was the very best, top of my class. I even used to teach the other students the alphabet. A is for Arsenal, B is for Basanal, C is for Sasanal, D is for Dasar. No. D is for discount.
To get Indian alphabet, dial star 812 star 805 hash. Skiza na Nation.
The authority is participating in the Insurance Regulatory Authority Open Day in the coastal city of Mombasa at Makadara Grounds from Wednesday the 23rd of June 2021 to Friday the 25th of June 2021 from 9 a.m. to 5 p.m. on all the 3 days. The main objective of the authority participating in the Open Day is to create awareness on capital markets products and services. An educated investor is a protected investor. Entry is free.
Invest in the prime plots from Finca Properties Limited, Equator Gardens Nanyuki, a gated community ready for immediate development. We also have Konza Suburbs, a gated community within Konza Metropolis. For details, call us today. Finca Properties Limited, prime and affordable.
All right, thank you for staying with Your World on NTV. We are talking about the progress of COVID-19 vaccination in Kenya. How many people have been vaccinated? Are we lagging behind? And of course, Dr. Willis Akwale, the chairman of the Kenya's National Vaccine Task Force, is here with us, as well as Dr. Andrew Were is the president of the Kenya Medical Association. And by the way, this issue of shortage of vaccines is not just in Kenya. We've also seen it in different areas across the African continent. And my colleague Eunice Omolo spoke to Barbara Nail. She's the country representative for AstraZeneca. Maybe we can just listen into this interview from earlier in the week.
We now have more than 77 million doses that has been supplied to low and middle income countries, with 38 countries in Africa benefiting from the AstraZeneca vaccine. Obviously, due to the devastating second wave that has happened in India, we have seen that supply into Africa has reached a critical point. And this is something that we are working with our partners on. And we stand very much united with what the WHO has said, that the COVAX and the Vaccine Alliance now need to work harder than ever together with the ministries of health, like what we are doing here in Kenya, for the countries that need supplies in Africa, as well as the countries that have enough supplies to donate. So if we look at the Serum Institute of India, which has been a trusted partner for Africa for vaccine supply over many decades, is because of the devastating second wave that's happening in India at the moment, that at the moment the exports are not happening. But they have given their commitment that as soon as the situation in India improves, that the exports will happen again. So what we are doing at the moment is, because the situation is quite critical right now in Africa, is that we are now at the moment working very closely with the countries that have high quantities of vaccines that they can donate in a way to serve as a bridging for the situation that we currently have. That we are seeing more and more countries stepping forward to make donations. And we see that this mechanism is already working. We have seen donations going into geographies such as Rwanda, we've seen Senegal, Lesotho, Burkina Faso, so in many countries, and also here in Kenya. We know that the Danish government has committed to donating doses to Kenya, and we want to commend the Danish government for taking that step. And I think also to the Minister of Health here in Kenya, as well as the head, a combination of private companies as well as governments have pledged an additional $2.4 billion to COVAX. So this means that COVAX now have 1.8 billion fully funded doses that they can supply into low-income countries during 2021 and into 2022. And we need to now work together to ensure that countries such as Kenya and other African nations get the vaccines that they need. The data would clearly suggest that if you get the first dose of AstraZeneca, you should get a second dose of AstraZeneca. However, there are a lot of ongoing studies looking at vaccine mix at the moment, and we should probably have the evidence around that, I would say, in the next couple of months. I feel really confident that we can ensure that the right level of doses will become available.
Right, Barbara Nail there, she's the country manager for the Africa cluster of the AstraZeneca vaccine, which is, of course, what we have relied on in Kenya largely and also across the African continent, talking about the challenges in production, the issues of shortages. She was speaking to my colleague, that is our senior health reporter, Eunice Omolo. And let's just pick up from where we left, and we are taking in more questions. We have Zach from Kikuyu is back with us. Good morning, Zach. Thank you for, of course, talking to us this morning. Do you have a question or a comment?
Morning, Victor.
Yeah.
I hope you can hear me now.
Yes, very well.
Okay, my question is this. I'm in the category of the 58 years and above.
Yeah.
I got my first jab on 30th of March.
Okay.
30th of March, and today is the 24th of June.
Yeah.
And I see I'm approaching the 14-week deadline.
Okay.
And I've tried to get my vaccine. I've gone to the vaccination center twice. And I haven't gotten my second jab yet. So I'm worried about missing the second jab because also the information is not forthcoming.
Yeah.
I'm not getting responses. I'm not getting alerts as to when I should get the second jab. So I don't know where really to go back to where I got my first jab or to try another hospital or another facility because the information is not forthcoming.
Okay.
We would like to get that clarification on where to get the second jab.
All right. Thank you very much. And I think you mentioned that you're in Kikuyu?
Yeah.
Okay. All right. So I'll allow Dr. Kwale to respond to that.
Yeah, let me start by apologizing that especially last week, Kenyans got messages asking them to go for their second dose and they didn't get doses.
Yeah.
There was a big hue cry, especially from Mbagathi. And I'll explain that this was occasioned by a delay in the delivery of the donation. If you followed the speech when we received the donation, the ambassador clearly indicated that with the vaccine movement across the world now, there's a lot of regulatory issues.
Yeah.
Both by the receiving country, the donating country, and the agency that will be facilitating that. So there was a 1-week delay to receive that, but we had to go through all the paperwork.
Yeah.
Especially given that now this particular vaccine was manufactured in a different country from the very first one.
Okay.
The first donation was from India. This particular one from Denmark, the manufacturer is in actually Italy.
Mm-hmm.
So we apologize. Now, we have a change system that is supposed to ensure...
There should be a system, actually.
It is there.
Yeah.
It is working. It has been facilitating, but of course the challenge has been just the availability of doses. So by the time we realized the vaccines will not come, we switched it off so that people don't show up. But what we have now, our plan is those who received messages last week and did not get the doses, they should go, and that health workers should give them the priority. Once you show your message, you'll be on the front queue to get your dose.
Okay.
Later on this weekend, our plan has changed a little bit, and we want to send to everybody due for next week. We are not going to give you a specific date. So we want to open it so that you can go to any facility. You do not need to just go to the facility where you are vaccinated. You will go to the nearest facility to you. You will choose the day that is convenient to you to get that vaccination. And we are also going to circulate the posts that are vaccinating. So Zach from Kikuyu is going to get that information as we move to tomorrow and Saturday. Where are the vaccination posts? And the messages again will start getting out. When we get adequate doses, this change system has a so-called self-registration module. You can actually go and you decide when, where you want to receive your vaccine.
Okay. And that's important because then this is a process that continues. We would want to see, as you mentioned, you realize that from what Zach said, he said he's approaching the 14-week deadline, which I think was moved from 8 to 12 and now maybe to 14. So we want to see a situation in the future where this gap and these issues of shortages is not seen.
Yes, absolutely, and it will all be it depend on the global supply. And for me, especially under the African mechanism, once we start getting almost 1 to 2 million doses. In fact, the plan and what we are preparing for is to vaccinate 2 million Kenyans per month. And that will require, once that is assured that the doses are coming, then a system that just gives you convenience to go and get vaccinated. The change system has that convenience, and it will work.
Okay. Let me just allow Dr. Were to respond to that, because I think last week we actually saw quite a number of doctors complaining on social media as well that they had been told, you know, go to this facility, there will be doses, and then they arrive, they're told either it's not there or it's run out.
Yeah, I think Dr. Hwale has clarified two issues there. Because one was the delay in the batch that you've gotten. Now that you've gotten the Denmark one, I think that I should be able to sort that out. But I think the other issue that was coming out also was where do I get vaccinated? Because that was quite a challenge. Some of them had been vaccinated in Kenyatta, including the student doctors. Had to be turned away and told to go to Mbagathi. But now, since if you have the message and number, you can be vaccinated there, I think that is a good move. So I think the approach should be, actually, should focus more on getting the Johnson & Johnson vaccines because of the logistical challenges involved, and I'm not being sure if you're going to get the other batches of the vaccine so that everyone can just be given one shot. And that solves the issue of one getting vaccinated.
Okay.
Moving to the Johnson & Johnson way is the way to go.
All right. Thank you. Let's just get another set of questions if we have them ready. Yes, we have. Yes, this question is from Washeke, says, who falls under the category of others? Because remember, we have categorized those who are a priority. And then also the other question was, are there efforts in Kenya? Kenya is making to push for a waiver. Okay. So let's start with the first one.
Yeah, so we have, when we began, we had these priority categories that were the health workers, the security teachers, and then the over 58. Remember, even the above 58 were not a priority at the beginning, but because of the third wave, they became a group. As we discussed earlier, there are people who will show up at a vaccination post. They are neither of them. Sorry. They are neither of them. And once they've come, some healthcare workers actually vaccinate them. Some of them may have even underlying conditions, as we've said. They know themselves, so they show up. So that is the category of others.
Okay. All right. And the other question then was, are we pushing for a waiver? Sorry. Are we pushing for a waiver? Because the critical issue here is the issue of cost. And in the current the next financial year, I think we've allocated 14.3 billion. But if we can get a waiver, then that means we get more vaccines.
The waiver being discussed is at a global level is the so-called patent waiver.
Yeah.
The people who produced this are being asked that they waive so that people can start manufacturing them. If that happens, then there will be improved global supply. That would mean countries that have the capacity to manufacture can. It will make it easier for even countries in Africa that are looking forward to manufacture to get that patent and start producing them without a lot of other regulatory requirements.
Yeah. Okay. And then maybe my last question personally on this one is, so 200,000 people have their second dose. More others are going to get their second doses from today. So what happens next? Can we party? Can we go to Naivasha? Can we put away the masks?
Absolutely not. Don't go partying. Don't drop your mask. Don't go and start kissing each other.
But I'm protected, Daktari. I'm protected.
The vaccine protects you from severe disease and hospitalization, first and foremost.
Okay.
What you need to know is that the vaccine does not stop transmission. It will not stop the virus from coming from me to you. The vaccine does not do that. However, what we are experiencing in countries that have huge coverage is that there's a reduction in that level of transmission.
Okay. So what does the vaccine do then?
The vaccine is to stop you from developing severe disease.
Okay.
So you may get
COVID,
the virus, you may get the virus, but you will not go to the point where you need to be hospitalized or have to be put on oxygen.
Okay.
Which is extremely important. Can you imagine when we reduce? Already right now in Western and Nyanza, you are seeing the hospitals being overwhelmed.
Yeah.
The sheer number of people who are having to be admitted.
Yeah.
Those who are seeking attention. You know, the amount of oxygen that is. So the vaccine will reduce that kind of burden.
And this severity is the one that leads to death, of course?
Absolutely.
Okay. And maybe I can bring Dr. Were on this one because as we wrap up this conversation. Dr. Were, yesterday a record of 30 people, it was 23 the other day, and another 30 people again died from COVID-19. We are sort of almost normalizing and looking at this figure. But this is a figure of people. These are lives being lost.
Yeah, I think we were doing well initially in when we had the first wave, the second wave. I think we dropped our guard, and especially when we started having these large political gatherings.
Yeah.
I think the Ministry of Health needs to actually stamp its authority because you're still seeing it happening in the country, and we're not completely out of the woods. The vaccine is a good thing, but it doesn't mean that we stop. We start disregarding the public health protocols by the Ministry of Health. So I think we all need to be responsible. We all need to ensure that the public is protected first. We get this herd immunity, and then we can resume our normal lives. But if we continue with the way we are conducting our businesses, the political rallies that we're seeing are back again. Of course, you mentioned the Naivasha event, the World Safari Rally, and there may be a super spreader event. Then I think we'll just continue going round in circles.
Okay.
And we may not be able to resume our normal lives.
And I like that you mentioned. I like that you mentioned the political rallies because for me there are 13 counties right now. I think in the Nyanza and some bit of the Rift Valley and Western counties, which are actually under a bit of more stricter COVID-19 restrictions are the ones we have in the rest of the country. And this is because their numbers went up. And part of that numbers going up is because of the rallies, which are being led by the same very leaders who should be leading the war and sensitizing the public.
Yes, I think it doesn't make sense for the political rallies to go on and then for the government again to go ahead and lock down these particular counties. So I think leaders have to take responsibility. They have to show leadership to protect the people they so are not to take care of. These are the. I think Ministry of Health and the Internal Security Ministry just have to stop the authority and stop this because If it continues, then we'll continue having more and more infections coming in, and that is not what we want to see.
Okay. And maybe, Dr. to you then, I mean, we are doing very well in terms of the vaccinations and all that, but if we become irresponsible and go back to this lockdowns, we are really sort of mark timing in a way.
Yeah, you are just trying to step in mud and hoping it gets into a hard mortar. Let me start by saying first, herd immunity. Herd immunity does not necessarily translate into personal protection, but it's important in reducing the level of transmission within the community. So you need personal immunity, you need to be vaccinated yourself first and foremost. So we shouldn't have people waiting, oh, we'll reach herd immunity. That's number one. Number two, the super spreader events. It is also important to look at the principles that COVID is highly spread in enclosed areas.
Yeah.
It may not be a one-day event. So in a funeral, for example, it may not be the day of the funeral that they spread. It is the planning. What happens? So even on Madaraka Day or any other national holiday, the choirs, where were they practicing? What were they doing? So those enclosed areas where people meet, and that is what really needs to be totally discouraged. Building up to the gathering. Even these political arrangements, you can be sure in the evening people are planning and trying to mobilize. So that really is something that Kenyans should avoid, where you have to get and gather into places that are enclosed with very poor ventilation.
Okay, but don't you think then there is a disconnect? Because on one hand, we are doing very well, trying to social distance very well at work, trying to sanitize, wear all the masks, and that is during the week. And of course, even take the vaccines. But then on Saturday, we go for a public rally and we roll back all the gains.
And this is exactly what we must discipline ourselves. We are in a war, and until the war is over, it's not over. So we must really continue ensuring we don't drop the guard. I think that has become almost a proverb now, don't drop the guard. And therefore, we would urge people who, especially where you see the chance of transmission is high, avoid it.
Okay.
Don't go there.
But the picture in many people's mind is the vaccine. The vaccine is like a bulletproof vest. I mean, yes, there could be bullets flying all around, but I'm protected.
You will be protected in terms of severe disease, but the spread is still there. And also remember, if you look at our data, the coverage is still below 1%. We are now moving towards, until we do 260,000 vaccinations of second dose, that's when we'll hit the 1% mark. In the countries where people are dropping, they have reached 50-60% population coverage.
Okay.
We still have a long way to go.
All right. And of course, we have to wrap up this conversation. We are talking about the progress of vaccination in Kenya, COVID-19 vaccination. There was a shortage. We've received 350,000 doses from Denmark, of course, on Monday. More, of course, as Dr. Akwale says, are coming next week. But, as he says, that vaccine is not a bulletproof vest, and you need to continue protecting yourself. Dr. Were, at the end of the day, this vaccine is just part of the fight. It's just part of the fight. All those other issues of wearing masks and social distancing have to remain, isn't it?
Yes, I think what we need to do as a country, as the public, is to ensure that we all adhere to the public health protocols as guided by the Ministry of Health.
Yeah.
And also now go a step further to protect yourself by getting vaccinated. I think that is the only way we're going to get out of this.
Okay. All right. Let me just then close, get your closing remarks for this conversation moving forward, because there are those who are really pessimistic. I mean, we've just come from lockdowns last year. We've just come from another one, I think, in May for several counties, including Nairobi. We've just gone into another one of course, in the 13 counties in the Nyanza region. And it just feels like there will never be an end to this. We just want to go back to our lives.
I think it starts by each and everyone taking personal responsibility. And as I've said, if you look at all the waves we've had in this country, they have been triggered by those particular meetings that have occurred. So let's stamp out the meetings, let's follow the protocols, let's get vaccinated, and then we'll see a break in that. There's a time actually our positivity rate was around 4%.
Yeah.
And things were starting to get back to normal. Then the rallies came, and all hell broke. So I think let's take responsibility as leaders. to be the one who shows it. Just the same way when the president took the COVID vaccine.
Yeah.
Everyone was able to follow suit and now have confidence in the vaccines. And I think it's the same way the same leaders need to actually come out and show us that actually we can stop these meetings, address the issue that we have, and then move forward together as a country, because it can get really tiring going from one lockdown to another lockdown. You know what you need to do to prevent that. But above all, I urge all Kenyans and the Ministry of Health to ensure that majority, at least if we hit the 30 million target, Kenyans will be, then I think we'll be heading in the right direction.
Okay. Dr. Kwale, there's someone definitely who's watching, and the first phase of the vaccination was for healthcare workers and those frontline workers, including security and teachers and all that. The second batch which has arrived is for the second dose of this, the people who took the first dose, and they're just wondering, when will be my time? When will be my turn?
The turn is coming with the supplies that we're expecting from Johnson & Johnson being procured by government, the 10 million doses. It's not absolutely far from now, but we are also expecting donation of Pfizer from the US government. That will also be a complete new group of people who have not received the vaccination. But as I've said, we are going to try to prioritize as we go down the line. In the end, we are committed to ensure that this vaccine is universally accessed by everybody who has made a decision that they need to get vaccinated. I want to thank Kenyans. The uptake is encouraging.
Okay.
Compared to any country in this region, I think we have a literate society. We have Kenyans are very mindful about their health.
Yeah.
They have turned up in very good numbers. I really want to urge them, go for that second dose to be fully vaccinated, so that when you hear of a third, fourth, fifth, sixth wave, you have that personal protection first and foremost. And then as many of us get vaccinated, then the protection of the community will come in.
That's the herd immunity thing?
That's the herd immunity.
Okay, all right. Let me just then close, get your closing remarks for anyone who, of course, is worried about maybe our progress, looking at other countries in Europe. People are talking about 60% of their populations vaccinated, looking at us and they're saying only 1%, or is it 0.1%? And they're like, will we ever get there?
It is a wake-up call for us. It is a wake-up call, and every day you can be sure the team that I lead, and working very closely with the entire Ministry of Health, we are saying there are lessons learned and we should not be in this situation at all. We have reached out to all potential sources where we can get quality assured vaccines.
Yeah.
The resources are now there. And we are just hoping, obviously the supply chain is improving.
Yeah.
So we are going to start seeing, we are moving from a season of scarcity to adequate, but I can see by the end of the year we will be in the season of plenty. And anybody who needs a vaccine should be able to get it.
So our targets are still within reach?
They are within reach, and I can see us moving in that direction. I only think it's the July and August that we may still be a little bit. But come September, we should really accelerate.
Okay. And I think, of course, from us at NTV here, we will be ready to hold you accountable to some of the promises that is said. He said it on live TV that by December, anyone who wants the vaccine, it should be, of course, be able to get it. And, of course, that brings us to the end of today's conversation. We have been talking about the progress of COVID-19 vaccination in Kenya, of course, and comparing it with other countries in Africa and also across the world. And, of course, many thanks to my guest this morning, Dr. Willis Akwale. He's the chairperson of Kenya's COVID-19 vaccine task force, as well as, of course, Dr. Andrew Were, who is the president of the Kenya Medical Association. From me and the entire team, it's goodbye for now, but of course you should keep watching NTV. The Safari Rally action is coming live all the way, of course, from Naivasha. But as we do that and have all the fun, remember COVID-19 is still with us and we should all play a part in protecting ourselves. My name is Victor Kiprop. We'll see you soon.
you.